my way. Khalifa.
Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. A warm welcome to this third live ideas session in which we invite one or more immunization practitioners working at all levels of the health system to share with you how they have been coping, adapting, changing in the face of the pandemic and its impact on immunization services. So the COVID-19 Peer Hub is going to kick off on the 27th of July. We have just a few more days in which applications will be accepted until the 26th. So you can see it's 3 days, 5 hours, 54 minutes and 18 seconds. There is a long and detailed application because we really want to understand what is your situation, what is changing, what are you doing about it in order to be able to share that with the rest of the community. I also want to invite you, if you've enjoyed these live ideas session, request your invitation to the global launch event on Monday, August 3rd. That will bring together all of the immunization staff who are facing COVID-19 and who are involved in the Peer Hub, as well as our country and global partners. So with me today is Charlotte Mbuh, who has prepared this session and has brought together an amazing panel today. Can you tell us quickly who, Charlotte, we have got with us today?
Okay, thank you very much, Reda. Good afternoon, evening, or morning, everyone. Today we have Samrawit Ejigu from Timor-Leste that's joining us. We have Ekpo Ufoma from Nigeria, and we have a special guest from the 7 team, Jen Frida, that is here with us today. Thank you, Reda.
Great, thank you, Charlotte. So let's start. We're going to dive right in. These sessions are short because we know how short on time you are, and so we're going to go to Samrawit Ejigu. Samrawit, welcome. How are you doing? Can you tell us where you are connecting from?
Okay, thank you, Reda. I'm Samrawit from Timor-Leste. I'm a staff consultant working for WHO. Now I'm in the capital city of Timor-Leste, Dili.
All right, thank you. And so you, Charlotte, you spotted the story that you shared in your application. This has to do with caregivers might be reluctant to come to health facilities for immunization due to fear of COVID-19 infection. Before we talk about that, we thought it'd be nice to share with everyone, and I see more participants joining us on Facebook. Welcome to all of you. You work in Dili, the capital city of Indonesia. So as we have people from all over the world, here I'm sharing the map with our participants on Facebook. So let's dive in now. Can you tell us, when was the first time that you realized that this pandemic was going to affect immunization? What were you doing? What happened that made you realize this was going to be a big problem?
Okay, thank you. I'm connecting from Dili, the capital city of Timor-Leste, not Indonesia. So the first case was reported in end of March, and immediately after a week, the government declared state of emergency. Then when everything stops and people start to panic, we know that the demand for immunization and other any routine services will decrease. So we start to follow up closely. We start following the community health center and health posters, whether they are continuing to provide the services. And the community health center and health posts were providing the service in the facility, but the outreach activities immediately stopped because of the state of emergency. And we know that many people living in a very far mountainous area without the road access will be affected when the outreach activities were interrupted. So when we start to follow the demand for immunization, it was declining starting from end of March, and April was the lowest. And it was we start to assess what was the reason. One is the caregivers were not coming to the facility because they were afraid of catching the virus from the facilities. Lack of transportation, because every public transportation immediately stopped after the state of emergency. And some people were not aware that the health facilities were still open and functioning. That's when we start to think about how we can maintain the EPI activity while the pandemic is still there, and how we can protect the community and also the health staffs to provide the service.
Thank you, Samarit. I'm going to let you breathe here to share. I'm sharing with the audience, with participants on Facebook, the graph you shared with Charlotte on showing the trend of children vaccinated from January to June 2020. And there's a clear drop when the state of emergency is declared in March. And can you tell us, what is the story? How did you experience the story? And you see the lines on the graphs going back up. Is there good news coming in the pandemic?
Yeah, when we see the performance or the number of children vaccinated in April, it was very low compared to the previous months. So immediately what we do is we start to assess the facilities capacity to identify, isolate, and refer COVID suspect cases before we dive in with the immunization activity. Then when we do that, at the same time, we orient all the medical and non-medical staffs in the facility on how to prevent themselves and how to continue, the importance of continuing routine activities. Then the health staffs were first panicking about the COVID cases, and they were not confident enough to come to the facility and accept the beneficiaries or clients. But after the training, they feel confident and they get motivated to continue the service as before with implementing the prevention activities. In the meantime, with the support from WHO and other partners, MOH developed a national guideline using the global WHO guideline on how to continue immunization during the pandemic. So it includes to provide the service daily in a facility with a cold chain, and also slowly to start the outreach activities, prioritizing the hard to reach and highly affected areas with a lot of dropout cases. And the other activity we did, there was a panel discussion at national TV using the public figures, the ministers, and also the well-known pediatricians who were also NATAG members. So we document those panel discussions on the flash disk and distribute it to the community health centers so that they can put on their television in the facility while the beneficiaries, other clients came to the facility. They can easily watch it during the waiting hours or the waiting places, waiting areas. And also, we orient all district level and community health center staffs on the new national guideline about EPI during COVID pandemic. So we created the confidence in the service providers so that they can continue the immunization activities as before by implementing the basic infection prevention methods or the basic infection prevention activities. We support them also to put in place the hand washing facilities and how they can control the physical distancing and also use basic PPEs like masks during providing the services.
So Samarit, you're giving us a very comprehensive big picture. We're also interested in your role. What did you do personally? So you wrote, for example, that what you did to improve. One of the things you did was to document all dropouts by village, and to give to community leaders for communication. I imagine to give the list of dropouts. You said you moved a refrigerator from other health posts to the health posts under this health center, and you conducted outreach to all villages under this facility. Can you tell us about one of those things where you were personally involved and describe what you did? What were the challenges, and how did you figure out that was what you needed to do, given how this is so unprecedented?
Okay. I'm a staff consultant here. There are 4 staff consultants. We are responsible to 2 districts. During this activity, our role was to assess the capacity of the facilities and also orient EPI staffs and support them while they document the dropouts. We provide them with the registration, and we mentor them how to identify the dropouts, document and communicate the community leaders. And we also support involved to do the performance evaluation by village, so that they can know which village is highly affected and which village needs a priority. So our role was mostly with the EPI staffs at the community health center, and also with the municipality or district level EPI focus, so that they can understand the situation and they can intervene swiftly to maintain the EPI activity. So this is the effort was from different partners, and also the leading activity with the Ministry of Health. They know, they understand the problem, and they point down what activities should be done with the support from the partners. So our support was to show them the real picture at the ground, because we are working with the community health centers and we know how the ground is functioning. So that's how we participate in this activity.
Thank you so much, Samarit. So you are from Timor-Leste. Charlotte and Mbuh spotted your story amongst the more than 3,500 applications we've received for the COVID-19 Peer Hub. Charlotte, hello again. And do you have questions for Samarit? And we have another... we have Ekpo Ufuoma, who we'll speak with next, from Nigeria, who works in a health facility. So we'll be hearing 2 stories in today's Ideas Live session. Charlotte, what are your questions for Samarit?
Thank you, Reda. For starters, thank you, Samarit, for sharing your story with us. I just want to find out concerning the many others who have shared stories or talked about caregivers hesitating to bring their children to health facilities. Was that the situation in your case, and how did you get to handle that?
Okay, yeah, the health givers were, they were afraid to come to the facility because they think when they come to the facility, they will catch the virus. The other problem was there was no transportation for them, public transportation to come to the facility, and some of them, they don't know even the facilities were functioning. When the state of emergency was declared, they think everything shut down. So they were not coming to the facility. So to address that, engaging the community leaders, the village leaders were very important. Here in Timor-Leste, we have village and sub-village. In every village and sub-village, they have their own leaders. And also below the sub-village leaders, there are community facilitators. So contacting these community leaders was very important. So the CHCs, they contact the community leaders under their catchment. The community leaders also, they were doing a mobile making in the village to let know the community that the facility still exists, and also the importance of continuing immunization activities while the pandemic. That's how we address the challenge from the beneficiary sides or from the caregiver sides.
And did you have to change the vaccination schedule because of that, in terms of maybe implementing these barrier measures, the turnout during vaccination sessions? Did you have to change your schedule because of that?
While during the state of emergency, we were not able to provide the outreach activities, so the immunization activity were limited to the facility level. So during at the facility level, they were providing immunization daily. We ordered them to give immunization in every health post and CHC daily. Some of the health posts, they were doing the immunization activity once in a week before the pandemic, but they start to provide every day because now we cannot afford many caregivers at the same time for the purpose of physical distance.
Charlotte, we have a comment from Anu Rotimi from Nigeria, who says many people have also experienced. Sorry. Our commenter from Anu Rotimi says many people also experience similar challenges in accessing services, including immunization in Nigeria. And this has been, of course, a recurring theme throughout these Ideas Live. And we expect to share the experiences, not only the diagnosis, what is that there is a specific problem, but also what immunization staff have been able to do in practice to actually carry out, to adapt and change. And that's a fascinating story, Samrawit, of how you have been able to cope, and it looks like you potentially recover immunization services, at least in some ways, in some places. Charlotte, any final questions before we go to our next guest?
No, Reda, I think it's good for me for now, and I'm not seeing any questions on the chat here on Zoom. Oh yes, so I've just seen a comment from Martha and a question. He said, were they just being afraid to contract the disease at facility level and not being afraid they could contract the disease through health workers in the process of administering the vaccine during outreach sessions? I guess that's a last question we are getting from Martha Ngoe, from addressed to Samrawit.
Okay, from the community side, what we observed, they were afraid to not to contract from the facilities. When they go to the facility, they think those who suspected cases also could be in the facility. There was no challenge in relation to immunization. They don't think that we haven't actually seen any challenge that when they get the immunization, they think they will get the virus also. No, that was not the case. The real case was they were afraid when they go to the facility, they will meet with the suspect cases or those patients, so they will contract the virus.
Right. One final comment from Okelo Ogwal-Hillary, who says, I'm in Lira district, northern part of Uganda. Thanks for sharing. Your response was more of a national program, and would like to know, we're not going to be able to cover it today, but it's definitely how the different levels of a system coordinate and work together. How was it adopted at community level is something that we'll be looking at in the Peer Hub. Who were the key actors and so on. Now, the reason we keep today's session, and we'll be keeping it short in the Peer Hub, is we know you're short on time. So it's about giving and receiving support when you need it. So on a question like this, through the Peer Hub, through the Ideas Engine and the other activities in the Peer Hub, you'll be able to ask a question, see what can come back from the network, or contribute to the network as well. So back to you now, Charlotte, to introduce our next guest. And I do want to ask Jen Seiler and Caitlin Christensen from the Sabin Institute. We've discussed, we would like to hear 2 stories first, but then that will take us up to 6:30 p.m. Geneva. Are you both able to stay an additional 10 or 15 minutes? In order to make sure. Okay, wonderful. Thank you both for your flexibility. So Charlotte, over to you. Could you kindly introduce Ekpo Ufuoma, who has been standing by in full PPE gear?
Yes, so I want to say welcome. Thank you, Samarit, and welcome to you, Ekpo Ufuoma, that's joining us from Nigeria. So your mic is already unmuted, so you go ahead and tell us who you are, where you're joining from, and what's your role as far as immunization is concerned in your context.
Okay, my name is Ekpo Ufuoma. As earlier on, I spoke with you on my PPE, but fortunately, I just closed from work. I had to doff. I'm calling from Nigeria. I work with NNPC Medicals, Nigeria, precisely Delta States, and I work with the immunization department in my facility.
Thank you, thank you, Ekpo. Charlotte, please, what questions do you have for Ekpo Ufuoma so that we can understand not her story and the specific practices, what she has actually done and how she's done it in ways that will be useful to other practitioners?
Okay, so Ekpo, the first thing I'm going to ask you is, how did COVID-19 affect immunization activities in your health facility?
Wow. Initially, when the pandemic started, everybody was scared. Caregivers were scared of even the booked ones. Because in my facility, like those that are being booked for yellow fever, when you open the yellow fever vaccine, you discard immediately. So we usually gather them. We gather the children and adults for yellow fever. But during the pandemic, at the start of the pandemic, we weren't seeing anyone. We know it's a family clinic for staff, so we all have their numbers in the system. We started calling, Madam, your child is due for yellow fever. Your child is due for DPT. Your child is due for varicella. The child is due for typhoid. So we kept calling and calling to the extent that we had to go home visiting. For some, even by the time they see you, they don't even want to open their doors. But
and what reasons did they give for that?
That the caregivers, the reason they gave was that the caregivers are the major transmitters of this virus. Of course, outside the country, a lot of medical personnel passed on as a result of the virus. So caregivers were actually scared of bringing their children for immunization.
Okay, so what did you do to get them to start bringing their children back for vaccination? What exactly was the message that you gave them?
I had to convince them that we go on our PP and we observe the necessary preventive measures. And I made them know the importance of the vaccination and the timing. So that's it.
Okay, and so with that, have you begun to notice a change? What's the kind of change? And are you certain that all your children will get their vaccines on time?
Yes. There was positive changes. After that, they were positive. Initially, when they see you on your PP, they are scared. For this person to be on her PP, that means probably they have had lots of cases in their facility. But you need to encourage them that you wearing your PP, you're trying to prevent them actually from contracting it and yourself.
So Ekpo, I heard you say, you say you spoke. I'd love to hear. If I'm a caregiver, I'm reluctant to bring my child for her vaccines. What do you say to me? What are the words you use to reassure me, inform me, and help me make that decision?
Okay. Okay. Let me assume you're the mother of the child. Okay, madam, You see, this immunization, it's so important to your child. Let's take, for instance, the child is to have, let's say the child is to have chickenpox vaccine. And madam, this child is due for chickenpox vaccine, and you are depriving this child from getting this vaccine. And you know where we are now, it's a community level. And I think as at the time of the beginning of the pandemic, there was chickenpox pandemic also in my area. So because of that, that was why we actually kept calling. So I would tell the patient, you know, now in this chickenpox era, you're failing to bring your child. If your child contracts chickenpox, the immunity becomes low. And if your child eventually contracts coronavirus because the immunity is low, you are now predisposing your child to a poor prognosis. So I'll make the caregiver understand that to understand the positivity, the gain in getting the vaccination than staying out of being vaccinated. And at the end of the day, they come in their numbers.
I see. Yeah. And how have you changed your key messages, what you say and how you say it during the pandemic, since the pandemic started and reached Nigeria?
Pardon?
How have you changed what you say and how you explain it? Is there anything that you're doing differently in terms of how you speak to caregivers that you did not do before?
Yes. I become more friendly with them.
Yep.
I became more friendly with them, soft spoken, so that they can actually get the vaccine.
Right.
So that they won't see me as a transmitter of the virus.
And can I ask you one final question for me? Where did you learn to do that? So to figure out how to, what's the right tone to adopt, how to speak, and how to reassure caregivers. Was that part of your training, or is that something that you have learned through experience?
Okay, yeah, you could say through experience, but it was actually a communication skill that we're taught in school.
Okay, yeah. All right, thank you, Ekpo. Charlotte, do you have any additional questions to better understand how Ekpo and her colleagues have been adapting during the pandemic to reassure caregivers who might be reluctant to come to health facilities for immunization?
No, I think it's okay for me now. Maybe I would have also loved how each time I want to is like doing some kind of sondage, just trying to get your vaccination schedule. Do you used to vaccinate every day or once a week? Has it changed because of COVID?
No. We vaccinate once a week. It's a fixed vaccination. That's in the hospital. We vaccinate once a week, and it's today, every Thursday morning.
Okay. So I now understand why you were all geared up in PPE. All right, thank you. That's okay for me now, Reda.
Great. Thank you so much, Ekpo and Samarit, our two guests for today's Live Ideas. This is part of the pre-launch activities for the COVID-19 Peer Hub, in which right now we have more than 3,500 immunization staff from, I believe it's more than 80 countries who have applied, and who, if you haven't received yet your letter to inform you of our decision, whether you're accepted to the program or not, you will in the coming days. We'll be kicking off activities on Monday and holding a global launch event on the 3rd of August. The point is to share experience, to spread ideas, the good ideas and practices that are emerging as everyone is having to adapt and change all over the world, and to connect these ideas together to take action to keep vaccination going during the pandemic. Now, I want to move to our final guest. We thought we would have one person on to tell their story. There have been so many amazing, interesting stories that that Charlotte has found and discussed with applicants to the Peer Hub, and we're super pleased to have with us our friends and partners from the Sabin Vaccine Institute. So Sabin has been doing a lot of work on this issue of vaccination hesitancy and vaccination acceptance, has recently published a report on the topic. I'm currently showing the Sabin Vaccine Institute website. And with us are Caitlin Christensen and Jen Seiler from the Boost community, recently launched by the Sabin Institute. So welcome to both of you.
Thank you. Go ahead, Jen.
Oh, you go first.
Hi, everyone. I'm Caitlin Christensen. I lead our Vaccine Acceptance and Demand Initiative at the Sabin Vaccine Institute. As Reda was just saying, that is an effort focused on improving confidence in vaccines in order to increase vaccination uptake. We're moving that program through a number of different strategies, including doing training for journalists and health workers and how to engage with media around issues of vaccines and immunization to ensure that credible information is reaching policymakers and the public, as well as through what I'll speak about now, which is investing in research that helps us better understand some of the challenges related to vaccine hesitancy and vaccination acceptance. We're looking at that both through the impact of social media on vaccine decision-making and through what I wanted to share with you all today, a small grants initiative. The small grants initiative that we launched this year, this is the second iteration of our small grants program, is focused on helping us understand what some of the social drivers are around vaccination uptake. This year, we launched a small grants request for proposals with a request for proposals by the end of this month, by July 31st, from researchers in low and middle income countries to help us understand specifically issues related to COVID-19 misinformation. Our goal is to invest up to $25,000 in up to 12 grants that will be led by researchers from low and middle income countries, and that demonstrate collaboration between researchers, universities, NGOs, and ministries of health to examine and help us improve our understanding of how the spread of misinformation about COVID-19 in low and middle income country context is happening, to help us generate evidence about the impact of misinformation on acceptance of a future vaccine and or demand for other vaccines and routine information, and then to test interventions that help to address the spread of misinformation. Again, all of this is to help us understand what some of the social drivers or barriers are around vaccination uptake so we can design interventions that will address them. You can learn more about the program. Thank you so much, Reda, for showing our website. There's more about the program on our website at www.sabin.org. You can also send questions to us at smallgrants@sabin.org. Sabin is SABIN. We're very much looking forward to reviewing proposals that are received by the end of this month, and we'll be sharing the results of those proposals as that research is ongoing over the next 10 months. We think that what we're learning from this can help us all understand how to better improve demand for vaccination and address and improve vaccine confidence. And then we have a number of different mechanisms through which we're sharing some of our learning. And I think Jen will speak just briefly about the Boost network.
Right. Thanks, Caitlin. Can you tell me, what is your assessment of how the pandemic, the COVID-19 pandemic, has sort of impacted vaccine hesitancy, already declared a global threat by the World Health Organization, but how much worse is it getting? What is changing from your perspective? And does that underline the particular urgency and relevance of this small grants program that might be of interest to researchers in the COVID-19 Peer Hub?
Sure, and thanks so much for the question. I think COVID-19 is certainly, we've just heard how it's impacting different immunization programs, and from whether that be fear of going to health settings to seek immunization services or other issues, certainly impacting, and particularly misinformation around COVID-19 is impacting how people feel about vaccination. And we have concerns about what that looks like when a COVID-19 vaccine is available. So misinformation could have the impact of individuals perhaps underestimate their own risk of infection. It may also then have the impact of how people feel about the safety or efficacy of a future vaccine. And so we think it's critical and urgent to address the spread of misinformation.
Right. Thank you, Caitlin. And now, Jen Seiler is. We have worked closely in recent months on the first adaptive leadership course specifically for immunization staff. Very pleased with this partnership and collaboration between the Geneva Learning Foundation and the Sabin Vaccine Institute, and the newest and, dare I say, the most exciting wing of the institute, which is the Boost community. Especially exciting if you're an immunization professional, immunization manager, working at the national and subnational level. Can you tell us more, Jen?
Thanks, Reda. And we love our partnership with you as well. So as Reda just said, I'm Jen Seiler, VP of Global Community Engagement at Sabin, really focused on our Boost community, which is currently 1,000 members strong. So we're focused on supporting immunization professionals worldwide, most particularly in low and middle income countries, at every level, from national down to district, down to facility, and really trying to figure out how do we support folks with most particularly content, as Reda just mentioned, around adaptive leadership, community building, advocacy, management. These issues and challenges and capacity that is needed couldn't be more urgent today than it has been in the past. So have a lot of offerings that we're pushing out currently, and building out a support, network so that peers can understand from each other what their challenges are, what opportunities we have to learn from one another. I think just to add a couple of notes to what Caitlin just said, we will be hosting a series of webinars starting in September. One around, Reda, the page that you originally pulled up from the Sabin Institute website around our recent report on vaccine hesitancy and demand. We're going to have folks represented from across different continents to kind of speak to what they're seeing and really how it can be applied today in COVID. We're also going to be partnering with a couple of other organizations on a webinar series also in later September to really dig into and start to apply and take some actions towards what do we know about vaccine hesitancy? What are some of those standards? And how can we start to move to implement them and understand on the ground what you all need? I mean, I think Caitlin underlined this, but it's about really focusing on the folks that are on the line here today. You telling us what the challenges are, what you need, and how we can support you. I think we appreciate how rapidly the environment is changing, how rapidly the conversation is changing, particularly around hesitancy and demand. That's today. Once we actually start rolling out a COVID vaccine, we know it's going to become even faster. And so Boost community is really thankful to be partnering with Geneva Learning Foundation on several things. Excited to engage with you all in any way that makes sense moving forward, but hope to see that some of you guys apply to also the small grants program that Caitlin just shared more about, and have you join us on our webinar series that'll come up in September.
Great. Thank you so much, Jen Seiler and Caitlin Christensen. And in the Ideas Engine, we certainly hope to bring you, so not only to facilitate conversations and exchanges between immunization practitioners from all over the world, but also to bring in partners and colleagues who work at all levels, both countries and internationally, who are also taking action, working on the coordination and the global mechanisms that are in place, and connecting the different parts of the system, because we need to do to do better, to go faster than we ever have before in the face of this pandemic and the impact it's having on immunization services. So look forward to, in addition to the sharing of experience, many voices, many professionals, researchers, scientists, policymakers, technical officers from global partners to be in on these conversations. And we hope to also be able to share the outputs, what your voices, if we are speaking in a corner, we need to move from the corner, center stage, so that voices from countries can be heard in many different places, as many places as we can facilitate, including, of course, the Boost community for immunization managers. That is it for today's session. Thank you, Charlotte. I want to finish with one more thing. So if we were in a room, there might be cheers or applause. So we found a way to do that. Let's give it a try. I'd like you, if you're in front of your computer, if you're still with us on Facebook, get yourself ready to clap and applaud if you feel that it's what you've heard today is commendable and worth applauding, from practitioners from Nigeria and Timor-Leste, and voices from all over the world. Ready? 1, 2, and 3. Thank you so much for joining us today. Tomorrow is the last Live Ideas. This will be Live Ideas number 4. And if you'd like to see more, I would like to ask you for one last thing. If you can go to the thumbs up, to the like button, and if you haven't clicked or tapped on it, please do so. If you feel, if you'd like to send some hearts to the voices that you heard in today's session, please do that as well. Thank you so much, and see you tomorrow.